All right. Once again, viewers, we say thank you for joining us on this program. This is Youth Empowerment, brought to you by Montec TV, coming live on Facebook from Nairobi, Kenya, in East Africa. Thank you for always joining us on such a program. And today on Youth Empowerment, we'll be discussing on a topic that we started in the previous program, and that is depression. Well, we all know depression has been a killer disease, not only to the young people, but to so many people. It has claimed the lives of so many in families, in companies, all over. It's an enemy to the entire humanity. And that's why today we are discussing about depression, what is depression, the symptoms, how to overcome depression, at some point the types of depression, and all those many other things. And today we are joined by one professional in that. She's a psychologist, she's a counselor, she's a wife and a mother. She's been able to work with so many young people and also many couples and people suffering from depression and other diseases and sicknesses. And today I want her to take us through matters of depression until to some point when you are healed. And maybe to begin, we'll have a recap of our previous program. It's always a blessing to have you, Madam Anne.
Thank you so much, Festus, for having me this morning. I'm happy, this afternoon, sorry.
Yeah.
I'm happy to be here discussing this topic that definitely is a challenge to many, and it is highly misunderstood. So we are just trying to see whether the little we'll be able to share is going to demystify the confusion around depression, and also be able to maybe enlighten the population just a little bit to be able to know how do I get to understand whether I am depressed. How can I help a child who is depressed? How can I help a family member who is depressed? Or maybe what are the how can I be able to become a support system for that person when they are going through even the aspect of treatment and everything? Yeah, so it's just a little bit on just awareness. We may not really give all the details that are needed to be known concerning depression.
All right, and as you follow us on that, Madam Anne said it very well. You can always ask us any questions that you have concerning depression, and can check on our Facebook page, Salem Consultants. We have materials that can help you in many other fields, and get to know what we do more on Salem Consultants. And also you can reach out to Madam Anne Karambu and on Montec TV. Kindly inbox us where you feel you need to be assisted. And we were able to look at what depression is, and we were able to look at some of the symptoms of depression. Probably you can go through a little bit of that.
So first we define depression as a disorder, a mental disorder that involves persistent feelings of sadness and lack or loss of interest in things that one would do comfortably. So it is a loss of interest, and it's also a persistent feeling. Remember, we get sad on various occasions, but now when that sadness is extended for a long time, then that is already a sign that maybe you're lapsing into a depression. So it is a mood disorder. Then we say that there are, of course, symptoms. One of them is now that sad mood. We said absence of pleasure in activity. We said there is loss of weight and appetite. We said sleep alterations. You either oversleep or have insomnia. We say the slow in movement, like walking, you don't feel like walking fast. Everything you do, you're doing with that slowness. There is fatigue, all the time feeling tired.
Yeah.
Then there is negative feelings towards oneself, hating oneself, being feeling low about themselves, feeling feelings of hatred towards oneself. There is feelings of guilt. We talked about mental limitation. Thinking process becomes slow. You're not able to think fast as you would have thought, or maybe you're not able even to concentrate on matters, like concentration span is limited. Then there is agitation and restlessness, and we also said in this there is aggression. You become very aggressive. When someone maybe hurts you or does something wrong, you become very aggressive. Or every time you're answering something, you find yourself becoming very agitated about the same. So those are some of the symptoms that we talked about. And remember, of course, when we were having the other session, we had someone who has gone through, Madam Rose, a pastor. She was able to give her experience and how she went through those challenges of depression. And she would also add on the issue of being unkept. You remember we said uncombed hair, not willing even to bathe. You can stay like a whole day, 3 days without taking a bath, and you are comfortable with it. We also talked about having the house being unkept. You're not interested with being hygienic. Or being in a place that is clean, because remember there is these feelings of feeling you don't deserve. So that hatred and the worthlessness that one is feeling at that point, and then also the low energies, they will make a person feel all those feelings that we've just mentioned. So we also said that it is a killer disease. It has also caused many to be paralyzed because of the same. So the need for us, at least, even if we may not be able to help all, but at least if we pass this awareness to our friends and family, when someone is in that state, you can be able to be of help. And remember, it is through these symptoms. We said if you have 5 of these symptoms, you are already depressed. If at least you have 5 of the ones that we've just given, the loss of sleep, the consistent mood, sad moods, we said those sad moods have to be extended for a long time, as at least for 2 weeks. You stayed for 2 weeks being sad. That is already an indicator that something is going wrong. So today, much of what we will be discussing is on prevention. What are some of the things we can be able to do to prevent our loved ones and ourselves not to get into the pit of depression? And also, how can we be able to assist those that are already into it? And then we will also get to understand what are the causes of depression. And then maybe be able to get into the types, which I'm not very sure whether we will handle today.
The types of depression. And try to check on some, let me see if I'll get that. I think I just lost that. We had a concern by someone who says, all right, I think I just lost that. Losing loved ones because of depression, not being able to speak out what you're going through. And Madam Anne is saying one very important thing, that if you realize you're having 5 of the symptoms that you've been able to share out here, that there's a high possibility you might be having depression. And we said it's important. Well, some of us will run to the pastor for prayer. Some of us will run into fasting, into prayer. But we were able to be told in our last program, and Madam Anne will be able to confirm that all that prayer is important. But it's very necessary that you get help from a professional counselor. From someone who will understand you more and more. Not because pastors won't understand you. No, kindly understand us clearly. We are here. We don't want to perish for lack of wisdom, for lack of knowledge. So Madam Manu confirmed that it's important you get to talk to someone, a professional in that, and you'll be helped. Because we've seen this thing kill so many people, and we ignore the symptoms, and we say it's a demon, it's something. I've seen that ignorance so much. So maybe we'll get into the symptoms.
Yeah, of course, we've just been able to handle the symptoms.
Yeah, sure, yeah.
So when we are talking about seeking professional help, there are three categories of people that handle matters of mental health. There is one, the psychiatrist. The psychiatrist is a doctor who is trained in handling medical issues, mental issues. So when you need medication, because depression is treated through medication, when you need medication and also further tests to be able to see to what extent the depression is at, you will require a psychiatrist to be able to do that. And then there are psychologists. Psychologists are different. Of course, there are those that are purely specialized in psychology alone, and they are not counselors. So they are called clinical psychologists. Those ones still also are able to handle those matters of depression and are able to guide on what the best measures. Again, now there is the counselor who are therapists. Their work is to help a client go through the issues that may be underlying. So there are times when all those three professionals come together to assist the patient. You will require the medication, you will require the tests, of course, done by a clinical psychologist, and you will also require therapy that it will help you go through the process of healing. So most of the times they work together. If the depression is not severe, you may only require therapy. But that one cannot be determined by the patient. It can only be determined by the professionals. They're the ones who are able to know at what level is this depression, so that they can be able to know who is best and what is the best treatment that is supposed to be given to this person. So when we were discussing on the issue of who is to assist a person who is depressed, we said that it is a disease like any other. So it should not be taken lightly, because when we go and we decide that now you only need somebody to talk to, because of course that is how people tell someone who is sad, look for somebody to talk to. That person you're talking to may not be able to understand the dynamics of once that you have talked to them. Will they be able to handle the issues? Will they be able to diagnose the extent of the depression? The same thing we also said, of course, yes, prayers are good. We are not saying that you don't pray, but the prayer alone may not be able to assist somebody who is already in a severe depression, who requires medication to stabilize the chemicals in the brain, so that they can be able to be in a normal state. So that is the purpose of awareness. Remember, we are purely creating awareness on this show. We are not treating yet. We are just, our talk and our discussion is just to create awareness. So once I know, remember the knowledge is power. When I know something and I know what I'm supposed to do, I will be able to know what to do with what.
So we're checking into that, and we are handling depression, looking at all that pertained in depression, and as Madam Ann said, we are creating awareness. So we're looking at how do we prevent, how do we avoid being depressed?
Yeah, so of course some of the prevention measures. We said that the first one is seek sufficient social, support.
Sufficient.
The moment you realize you have these symptoms, at least even if there are two, even if it's just the sadness or it's just the sleep disorder,
Yeah.
it is important to start seeking support. Social support can come from family, social support can come from friends, it can come from the people around us. So the moment we start having those feelings,
Yeah.
or those symptoms, it is important to seek social support. Remember, these are the people that are also going to assist us to be able to go seek professional help.
That's right.
So the moment we have spoken to someone that I am feeling this way, they will be able to help us also seek professional help.
Yeah.
Remember, depression does not hurt.
It doesn't hurt.
No, I am not feeling pain. It is just I am disturbed mentally. I am not feeling any pain. So I may not be able to take myself to hospital because most of the times we associate sickness with pain. But here now I am having emotional pain.
Yeah.
Which is so consistent and is completely stopping my me being able to move on with my normal life. Then we get to when you have strong relation ties in the family, at work, it is necessary to enhance that environment because it is from the family that someone will be able to realize, I think there is something wrong. This is not how you behave all the time. There is something that is happening. There must be something that is not normal because you are behaving out of your normal. So at your place of work, they will be able to assist you to know that there is something that has changed in your system. You will be able to understand, I think I am behaving this way because I am not. Okay, so the social system will mostly are the first people to help you understand that something has changed. I don't know whether that is clear. So friends also help because remember the people we interact with most are the ones who know who we are, how we behave when we are sad, when we are angry, when we are excited. So if I have an extended period of time that I am always sad, my friends will be able to tell, I think something has changed about me. And they will be able now to cause an alarm to me so that I can be able to seek help. The second one is keep active.
Keep active.
A low mood can vary so quickly when one gets busy with some activity. To avoid depression, become active. Mostly when we are sad, when we are stressed up, when we are going through something hard in our lives, you just want to stay in the house and just sleep. You don't want anything else. You just want to remain there and just sleep in bed the whole day, not talking to anyone. But one of the ways to help us even overcome those stressful situations, the first thing is to be active. You can be active in the house with house chores. We can be active with like just walking, having a walk, a run, something. But reading, listening to music. The moment we are active, we are able to distract our thought system that we will not get or sink into that depression. So activity levels are supposed to be increased, especially anytime we are going through an emotional turmoil, issues of loss, issues of rejection, sickness. Those are times when somebody is very easily able to get into a depression, or you've gone through a traumatic experience, like war has happened and maybe you lost the whole family, or something like the things we were having here in Kenya, issues of terrorism, the challenges we went through. If we have experienced those traumatic experiences, the best thing to do is to be active. When we become especially when we realize those sad moments are creeping in, we start by becoming active. It is good to explain at this point that a person who is already depressed may not be able to be proactive in being active. They may not be active on their own.
Yeah.
So at times they will be withdrawn, but they can be assisted by, again, the social system, to be able to be assisted to get out of the house, to go around. You can assist them to walk around with them, allowing them not to stay alone, and especially enclosed in a house alone. So you create activities that can be able to help them be out there. The next one is accept the past.
Accept the past.
Be in agreement with the things that have happened in the past. Remember, most of the depression happens because of issues we have gone through that have attacked our emotional stability, and we got stuck. We were not able to go over them. We were not able to seek any help concerning them. We never went to seek even professional help to go through them. So you got stuck into that past, and you live a life of why me? Why is it that I am going through all this pain? Why is it, and issues of guilt and shame? They are tied in the past. There are things maybe you did in the past and you're not able to forgive yourself. So all through you live a life of hating yourself. Or you went through some rejection growing up. You live all the time wondering, why am I existing? So when we are not able to handle the past, issues that have happened to us in the past, what is going to happen is that these issues find their way of messing with our mental status. And of course, it starts as a stressor. It starts as stress. Before we know it, now it is depression, because it is something I am constantly thinking about day and night. So we need to handle our painful experiences, regardless of how painful they are. Is it a traumatic experience like rape? It is important that it is dealt with hands-on, because if it is not dealt with, what is going to happen is that it will have a way of crushing us to the point of making us get into depression. Is it loss of a loved one? Sometimes people have lost the whole family, and somebody is not able to overcome that loss. You live with that pain inside. Every time you remember, it's like it just paralyzes everything about you. So when we go through past issues that are traumatic, that are painful, that are stressing, the best thing we can do is deal with them. How to deal with them? Seek professional help, so that we can be able to unearth all those pains. And mostly when they are childhood traumas, most of them, people are not able to handle them at all. When you've gone through rejection in the family, somebody has gone through rape even when they were very young, you are stuck with those emotions. Issues of addiction. When you are addicted to something and you don't know how to overcome it, it can also make you feel unworthy. Those feelings of self-rejection. So in the process of rejecting yourself, you lapse into a depression. The other part is, of course, thinking correctly.
How do you think? Okay, thinking correctly.
When I'm talking about thinking correctly, is about positivity. Not during any time. You know, life is not a straight line.
Right.
And it is important to explain to even our children as they are growing that life will not always be a straight line. We will not always experience good times alone. In the process of growing, in the process of living this life, we will meet situations that are not appealing to us. Most people are not able to handle hard times in life. They are not able to they don't know how to deal with things that are not appealing. So what happens when things that are challenging in our lives come, we look at them negatively. And it's like you look at life and you cannot see anything else other than the negativity that has happened to us. So if we are thinking in the thought process of being negative, even when good things happen again, we will not appreciate them anymore because a negative situation happened in my life. So I get stuck at that level and I become negative for the rest of my life. Assume maybe I lost my, a person lost, or I lost my parents when I was young. Definitely it is a traumatic experience. It is painful. It is sad. But it does not mean that my life has come to an end.
That's right.
But there is a likelihood of defining my life from the day I lost my parents. There is a likelihood of defining my life with that traumatic experience. Maybe I experienced a rape when I was a child. There is a likelihood of holding to that negative event that happened to me and getting stuck in that event. But when we are thinking correctly, when we are positive, we can be able to draw positivity from every experience we go through. Of course, that statement does not make sense to a person who is hurting. It does not make sense. Especially when you are going through that very situation, normally it does not make sense. But it is the truth. We can be able to take and look at every situation we go through, and it can be positive for us. It only depends with how we take it, how we look at it. Are we allowing it to break us? Are we allowing that hard situation we've gone through to destroy our future? If we allow, it is going to happen. But there is a way we can look at it and say that, yes, it has happened, but I will rise up and become the person I have desired to become. That is thinking correctly.
Correctly, right?
So thinking positively and avoiding negativity. There are some people who are very, we call them pessimists. They are very pessimistic about life. But the opposite of it is being optimistic. Looking at life with high expectation. Looking at life with great expectation, expecting nice things to happen to us. This is what we are advocating, because if we go the pessimistic way, that all the time you look at the glass as half empty, there is no time we will at any point look at the glass and say it is half full. All the time we look at the downside of life. If that is how we look at life, definitely we will get into depression, because life is not easy.
So the perception matters a lot.
Yes, we will lose jobs. We will lose loved ones. We will get sick. We might even get deformed. So life has not given us a straight line, a straight path that we will live in. But when we are optimistic about life, it does not matter what happens to us. We will always draw something positive from that event that has happened to us. But when we are not optimistic, definitely we will lapse into a depression. So a prevention is living a positive life, looking at life with positivity, with great energy, and with high expectations, that although I might have gone through that challenge, I will still get out a stronger person. So look sanely at the past. I mean sane, being sane.
Being sober.
Being sober. Become sane concerning things that have happened in the past. I don't know whether you've met these people that all the time they have this victim mentality. This mentality of why me all the time, pity party. I mean, if I meet with that person today, they will tell me the story they told me 5 years ago. I am still stuck at the past. I have refused to get out of that place and become sober concerning the things that happened to me in the past. Because normally what happens when you become a victim, you have an opportunity to always blame someone else, not us. And of course that one gives the person a little bit of satisfaction. So we need to be careful not to live a life all through of being negative or all the time being the victim. Because if you live a victim life, that life of a victim, I am assuring you, we will lapse into depression. Because one of the things that we are assuring each other here is that we will go through painful moments in our lives. There are things that will not be pleasant in our lives. We will lose loved ones. We will get sick. And the sickness may not be an easy one. We might even lose our businesses. We may get into an accident and you may become deformed. So how are we going to handle that thing that has happened to us? We have to be sane.
We have to be sane. Have to be sober.
Not a victim mentality. Because the victim mentality will definitely make you a victim forever. Because you don't take responsibility of your life at any point. You have handed over the responsibility of your life to someone else. It is because of my parents. It is because of this sickness. It is because of they don't love me. It is because they hate me. And that is why I am living this life.
So best to avoid that.
And you live as a victim. But you realize it is painful to live as a victim. Because you will never live your full potential as long as you are living as a victim. So, yes, hard times will happen. Very traumatic moments will happen to us. But how we interpret things that have happened to us in the past determines whether we will be able to become the people that we are supposed to be, or we will lapse into a depression.
So it's possible to prevent depression?
Not fully. Because as I said, we will be handling the causes of depression. There are some that are completely medical, completely genetic. You have no control over them. But if they are connected to emotional pains and turmoils, definitely we can be able to control that. Yes.
Right. Those are some of the ways on how to prevent depression. And one of the strongest points is the social support. Because at times people will seclude themselves from others. And you feel like, I don't want to see anyone close to me. They don't understand me at this time. And have we exhausted really all the ways?
Yes, the prevention we are done. We've done the social support.
Yeah, sure.
We did keeping active.
Keeping active. Yeah.
We said accept the past.
Yes, it has happened.
That it has happened. There is nothing much we can do about it. We said think correctly. Be positive.
Yes.
Be optimistic. Then we said look sanely into the past. Don't take the victim mentality.
That's very powerful.
Yeah.
And as we continue to hear about this, dear viewers, at the left bottom of your screen, at the right bottom of your screen, we have some poster playing there. That's our Youth of Purpose conference coming up to us this week on Thursday. On Thursday from 9 p.m. to 11 p.m. East African time. We are inviting you, all the young people, all your friends within East Africa, in Africa, and all around the globe. You can join us, not only the young people, but even parents. I'm sure you're going to learn a lot. Remember, you have those sons and those daughters. It's time for you to be empowered through these young people. We have the meeting details written in that design poster. You can also have the clarity of those details from the personal account of our guest, Madam Anne Karambu. Just go on Facebook, search for Anne Karambu Mwangi. You get the poster details, the meeting details there. You can also have them on my personal account, Festus Mwandi. You'll have the meeting details there. And our technical team, I can see they've given us the details very correctly. We are having them there. Thank you so much. Youth of Purpose Zoom conference. It will be this Thursday from 9 to 11 p.m. We'll be having our host, who is our today's guest, Madam Anne Karambo, together with myself. And we're having guest ministers to help us go through that. That is Pastor Van Adams and Pastor Tabby. Pastor Adams from Michigan in the States of America. Then you have Pastor Tabby, one of our pastors here in Nairobi. Christ is the Answer Ministries of Thika Road. I'll also request the technical team, as we continue to have the meeting details, the password and the ID of the meeting playing at the bottom of the screen as we continue with the meeting. Thank you. I mean, with this program, you've been seeing much of Madam Anne Karambo come that day. Of course, she's not any longer new to us. She's been a blessing. All right. So she's been able to explain to us how to prevent depression. It's possible to overcome depression.
Yes, it is possible to overcome. People have healed fully from depression. Others are not able to fully heal. So there are some that remain with medication for a long time. Those are the antidepressant and others. There are some that have to really take medication for a long time. But yes, depression is preventable and treatable. So we don't have to go to the extent of suicide and destroying the lives of even our loved ones and also ending our purposes. We can be able to be helped and healed. Yes. So there is hope. People have healed. Many people have. Yes.
And I confirm that from you because I'm sure you've met quite a number.
Yes.
But I won't stop. I'm not really marketing or advertising our guest, but honestly, I know so many people have gone through our hands. God has been able to restore them, marriages, young people, people of all ages. You got a question? Kindly text us that question. Our guest will be able to help you overcome whatever thing you're going through, even if it's beyond depression. Any matter that you may be going through, it's possible. It's possible. So after how to prevent depression, what are we having next?
So we are getting into the causes of depression. What are these things that happen to us that we find ourselves depressed? Because of course every sickness has its causes. Remember, although we give causes of disease, most of them are not automatic. That because I have this symptom, I have this sickness. Because I have this cause, I have this sickness. So the causes we will be giving here are not specifically, it is not a must that because I have these causes that I have depression. So it is good to have that disclaimer. And remember, this is purely for awareness purposes. This is not treatment.
Yeah, sure. We're not yet at the level of treatment. This okay.
Yeah, so it is, of course, it is not very well established, just as I said, the causes of depression.
Yeah.
So there are possible causes. Remember, they are called possible because we are not very sure whether they are also the causes.
Oh, okay.
Science has not been able to tell us exactly the causes of depression, but some of them is the genetic features, just the way someone has been formed genetically in their makeup. The genetic makeup of their lives. So change in the brain neurotransmitters levels. Now that is a difficult statement, but it is simply the chemicals that make the brain. When there are changes in those chemicals in the brain, you may get into a depression. Then there are environmental factors. When we are talking about environmental factors, we are talking about definitely the things happening around where that person is living. Maybe you may be in a place where there is war happening. You may be in a place where maybe there is a lot of addiction. People are getting addicted, and you may also be in a place where there is a lot of abuse, either physical or emotional abuse. Those things can predispose you to depression. The environment that person is in. So that one covers and environmental factors covers many others. It may be economic issues, issues of maybe lack, extreme poverty levels. Those things can be able to expose someone to depression, because I am trying to make my ends meet and I'm not able to. So definitely I will get into stressful situations. Remember, depression sometimes comes with stress first before it gets to a depressive disorder. So there are psychological and social factors. Again, psychological issues are now like trauma, addiction. We have loss and grief. We have abuse. Those are the psychological factors. Then, of course, the social factors. Then we have additional conditions such as bipolar disorder. There are other conditions that just present themselves because of others, but still it brings depression.
Right?
So we've said genetic, we've said changes in the chemical brain that had named neurotransmitters. We said neurotransmitters. We said there are chemicals in the brain. Then there is environmental factors, and we've said the psychological and the social factors. Psychological, we said loss and grief, we've said abuse, we've said trauma, and many others that affect our emotions. And then we said, of course, now additional conditions such as bipolar disorder. Bipolar disorder is a type of depression on itself. So when we will be dealing the types, we will be able to see that one. So depression is treatable, and managing symptoms usually involve 3 components: support, psychotherapy, and drug treatment. What we mean support, support is the social support we receive from friends and loved ones and church. And that support is very key to the person recovering from depression. Then there is psychotherapy. Psychotherapy is what much of what I am doing now is psychoeducation. I am giving awareness of depression. So the moment that person knows what is happening to them, they will be able to seek help. Then there is therapy. Therapy is when you come to a counselor or a clinical psychologist, and you have a one-on-one session where you are able to delve into your issues and the things that are affecting the client or that person. Then there is the drug treatment, which I said is offered by psychiatrists, doctors.
Not the counselor, not the psychologist.
No, it is by the psychiatrists, the doctors, and of course the psychiatric nurse and the psychiatric clinical officers. But that is completely a medical ground. Yeah. Counselors don't give medication. We are not trained to do that.
So please get it clear from our guests and from this program that you can get professional help from either counselors, psychologists, or even psychiatrists. But in that case, the only one who is permitted to give medication is the psychiatrist. And the psychologists, the psychoclinical, what are they called?
I said the clinical psychologists.
Yeah, the clinical.
Of course, they're the ones who determine what extent is the depression.
Is the depression.
All
right. So we got some of the causes.
Don't mind the explanations. Don't mind that. But the 3 parties that are supposed to help in the treatment is clinical psychologists, counselors, and the psychiatrists.
So with that, you're helped. You're set. And when we come into some of these terms, Toward, it's good to master your own field, and that's not give an excuse. So what we are saying is that it's possible to overcome depression. We don't want to lose anyone else into depression. No, we don't want to lose anyone else into depression. And when it comes to some of these the genetic causes of depression, is there a way to overcome that?
Remember, genetics, really there is nothing much you can do about it, because it has to do with your formation, the way the body is formed. So you may not be able to do much about it. You are just genetically predisposed. Because of the way you are formed, genetically, you are predisposed to depression. So of course now all you can do is get support, get treatment, and of course now the psychosocial support.
And you're going to be well
yes.
again.
And of course avoid the stressors. Avoid those things. You remember the things we was talking about, prevention?
Yes.
If you can be able to avoid extreme sadness, situations where you are covering up a lot of pain, prolonged painful situations, and you just cover them. Now if you're predisposed genetically, it means you will be easily get into depression rather than a person who is not predisposed genetically. So that's why the need for all of us, because we don't know whether we are predisposed until we do the clinical test. The point we do the chemical test, that is when we will know you are genetically predisposed. So seated here, I cannot be able to tell whether I am genetically predisposed or not. So by the time I am reaching to the psychiatrist so that he can determine I am already sick. So the way to prevent is to make sure, have I gone through a traumatic experience? Have I lost someone? Have I gone through pain? Have I lost a job? Am I going through painful situations that I cannot be able to manage? Seek professional help early.
Seek professional help early. As we continue with that, we coming back to those other causes. Let me see. I'll request our technical team once again take us through that. The meeting details for our conference. All right, those are the meeting details for our forthcoming conference this week on Thursday. That will be Thursday night Kenyan time from 9 p.m. to 11 p.m. 2 hours. 2 hours. We'll be having 2 guests handling 2 different topics. And we'll also be having our hosts. Our guest will be the host. I'll also be a co-host there. And we'll be having, that is Madam Anne Karambu. She's been our guest for a long time. And this time around she'll be a host. We'll be hosting the program together with her. This is a powerful conference you don't want to miss out. We'll be having Pastor Van Adams from Michigan in the States of America. We'll be talking about the place of the young people in the church. The place of the young people in the church. Remember, we are careful about you young people. Oh yeah, indeed we are. And we'll be having Pastor Tabi from CITAM, Christ is the Answer Ministries in Kenya, a branch of Thika Road. Those who in Kenya understand that language. Then Pastor Tabi will be talking about who am I in Christ. And I'm sure being able to handle a few things. I'll request our guest to talk a little bit now as a host for this conference before we get back to depression. We'll be having 2 powerful ministers of the gospel. And of course, 2 amazing topics. Who am I in Christ? And also the place of the young people in the church. Can you take us through about that?
Okay, without preempting the topics that will be discussed, remember our even our program in this segment is youth empowerment. So our desire is to empower the young person to take their place, not only in the church. It's only that this topic is specifically speaking about the church. But in the future, definitely, we will also bring a way How can we be a voice even in the nation? So our desire is to empower the young person to become that person they are supposed to be, so that they can be able to exhibit their full potential. Remember, something whose purpose is not known will be abused. That is a quote by the late Miles Monroe. He said, anything whose purpose is not known will be abused. And most of the young people abuse their potential. They abuse their energy. They direct it to the wrong places because they don't know what it is. So because I don't know the purpose of something, I will definitely abuse it. I give an example of a 2 or like a 5-year-old. As much as I love them, I cannot give them a car because they will not know the purpose of that car. They will look at it as a toy. I'm not talking about a toy car. I'm talking about a locomotive, a car that is moving. So that child will not be able to know its purpose. So they will abuse it. The first thing that will happen is unplugging any knob that can be unplugged. That is where they start because they don't know its purpose. But if they know its purpose, they will nurture it and honor it. One of the things that I've realized over the years is that we don't know the purpose of our body. The moment I have destroyed my body, because I have not gone to any shop where they sell body spare parts. I don't know whether there is anyone who has gone there. So there is nowhere. So the moment I have destroyed the only body that I have, it means I will not be able to fulfill my purposes in the years to come. Assume as from the age of 15, I started drinking alcohol. By the time I am 30, my body is already degenerating. What I mean by degeneration is that my organs are not functioning the way they are supposed to be functioning. But because I did not know the purpose of my body, I started abusing it early. The reason as to why young people will get into sexual sin, it is because they don't know the purpose of those sexual organs. They don't want to use them at the right time, the right place. So by the time they are supposed to use them at the right place, they are already degenerated. Or maybe I'm already at this place where I am not interested. And that's why we have people in marriage and they are not completely interested with the marriage bed. Because I wasted it when I was young. So when we talk about youth empowerment, we are talking about who am I from the point of as a person. What is the purpose of my body? What is the purpose of my my mind? What am I supposed to do with my energy? What am I supposed to do with my giftings? What am I supposed to do with my abilities? Because the moment I know what I am, I will value it. And I will take care of it because I know it is valuable. Anything that is valuable, we hide it in the best place. But when we don't know the value of our own lives, then it means we will destroy them. And that's why, of course, like the setup we are in right now, I'll talk about Kenya. Life is about raving. Raving, I mean moving from one club to another, drinking. But what will become of that body by the time I am 40? Definitely, either I will be on the trenches of Siwa, sleeping there, or I will have died because of liver cirrhosis. I have drunk too much alcohol. That body will not be able to carry me for 80 years that I am supposed to impact the world. So when we are talking about youth empowerment, those are the issues we might be discussing, because this is not a one-time meeting. We intend that whether it is possible, we can be having a forum at least every Thursday. And now that Zoom is here with us, we can have comfortably that forum every Thursday and be willing to ask all manner of questions. We will try our best to ask and also bring in guests that can be able to answer our life issues.
And there you have it, our dear viewers, coming to you on Thursday. East African time, 9 p.m. to 11 p.m. much of what Madam Anna has touched on. We may be focusing on that and many, many other things revolving around youth empowerment. Remember, we always talk about the empowerment, what concerns you, what is meant to build you and mold you to become that young person. And that's why we had to deviate a little bit from today's topic, depression, and get to tell you about that. And for the very final time, allow me to ask our technical team once again to give you the details of that meeting. We are very intentional. We are careful about your destiny and your purpose as a young person. We are very intentional about that. And there we have it. That is Youth of Purpose Zoom conference. All right, on your top left, we have Pastor Van Adams from the States of America, who'll be looking at the place of the young people in the church. As Madam Ann said, we don't have to only have those young people who go to church. It's for all of you young people. Kindly allow your parents, allow your kids, parents, allow your teens, allow the young people, support them. And you young people, kindly provide this design poster to your parents. Let them know that you'll be involved in a powerful conference on that night of Thursday, Friday. Then we have Pastor Tabby Muthoni of Sitam Thika Road will be handling Who Am I in Christ. And we'll be having Madam Ann who is here. We are ready for you. And I'll be there. We are ready for you. And God bless you for planning to tune in. Our technical team will be giving you at the bottom of your screen the ID of the meeting and the password for the meeting. And God will bless you. Thank you. We're here to divert a little bit to that because we want to reach out to as many young people this coming Thursday. I'm sure you're set for that.
Yes, we are. We are set. Mm-hmm. We are ready. And my principle is always change one, change many. So the moment we are able to transform one, we know that one can be able to transform the world. So that one is you.
That one is you who is listening, viewing us this afternoon. And we might be having some young people or maybe some other adults who are saying, I don't think I'll make for that conference. I already feel depressed. I want to talk to that young man, that young lady, that person who feels like no.
Maybe let's say that at one point in the life of every human, there is a point we get into depression. Because as I said, life is not a straight path. So at all times, we will always get to that moment where we feel low. Maybe I can start with my most recent. It was just the other day in the month of July, I lost my mom, a person who was a pillar in my life and in the life of every other person in the family. Of course, those are moments that are depressive. You will get depressed. But the best place and the best thing that I have seen when such moments happen to us, the best starting point is when we look at those things positively and being grateful. The power of gratitude. There is always something we can be grateful for. Like one of the things I was grateful for when my mom passed on, Festus, was that my mom never got sick. She had cancer, but there was not a single day that she was in pain. Yes. She died on the hospital bed. I think we had seen her like on Friday, and she passed on a Monday, and she had no pain.
Completely.
No pain.
So your mother rested.
She was sleeping, just resting. Two, we never used the monies that people use because of cancer. She got admitted in hospital, in a hospital bed for a week. 1 week only. We were not able to use all the resources people use. And can I be grateful for that? Yes, I can. we had an opportunity to give my mother a nice send-off last year. We had a whole gathering for everybody in my family, and they blessed us with my dad nicely, and it looked like, wow, this is wow. We never knew that was the last blessing we were receiving. So I am grateful that I had that opportunity. So it is if we are genuine, we can only look for something to be grateful for, even in that pain you are going through right now. There is something we can be grateful for. There is something we can thank God for, even in that hard situation.
So
gratitude.
Yes, gratitude.
And looking at life positively. Because pain, we will go through it. I am not here to say that we won't. We will be sick. We will go through times. We will lose our jobs. We will lose our income. Worst of all, we will be in a position where we are not able to earn any income. Because when I'm sick in a bed, I will not be able to earn any income. But how do I view that situation? So the best I can say is, let us start from the point of gratitude. I have seen it heal us very fast. It is hardly 2 months, and you feel that feeling of just satisfaction and being able to release mom to rest. And you don't feel that part of why me. There's a day I was wondering, why not me? So who did I want
to lose
to be the one? Yes. Why not me?
I think it's taking life positively.
Yes, it is about taking life positively. So yes, we can look. There is always a silver lining in every situation we go through. There is always something good about it. Yes.
Wow, powerful. So there's no good reason enough to prevent you from joining us in that powerful Youth of Purpose meeting. Depression Talks continues in our next program. See you next week, same day, same time, same channel. We've been having our guest, Madam Ann. I'm your host, Festus. Weka hiyo posta tumalize hivyo. Wewe nini bro? Time nasema.
Endelea tu